Hello and welcome to this week's What Were They Thinking? First, we have more information on the CCP virus and possible relationships to cardiovascular disease. There was preliminary evidence, and tenuous evidence at that the CCP virus was increasing the incidence of blood clotting in younger people. If it was in the elderly, it would be less surprising, but a problem. But the indication of it in younger individuals is a problem if they develop a more severe case. The problem with what they've found now is that there might also be heart damage on top of that. It would seem that about 10% of the patients with the CCP virus have heart disease, diabetes, and hypertension. By contrast, about 6% of patients with the CCP virus have pulmonary diseases like asthma or chronic obstructive pulmonary disease. These results are relatively consistent across China, Italy, the UK, and the US. This would indicate a universal pattern. Heart and lung damage is a product of the ACE2 receptor on the cell surface of the heart in particular, but also other organs. What is important here is that the CCP virus can exploit the ACE2 receptor, and since the heart has a large proportion of ACE2 receptors, it is particularly vulnerable to the virus. The body's means of dealing with a viral infection is to attack and destroy cells that present the surface protein from the virus. Myocardial cells can't be recovered, which means when they get damaged, the heart is more than less permanently weakened. This gets worse the longer the disease rages on for. This gets worse when you consider the prospective occurrence of a cytokine storm. This is a situation in which the body undergoes a rapid inflammatory response to the virus. If it occurs in conjunction with other conditions that affect the heart, like fulminant myocarditis, it can cause a massive issue, leading to the death of the patient. This all owes to the way it is an unregulated response which causes excessive inflammation across the patient. No system is left untouched, which means the body as a whole undergoes this process and ultimately can't cope. The extremely old and the extremely young are physically unable to cope and will die, whilst those in between have a bell curve of response. On top of issues with the heart, CCP virus patients are reporting neurological symptoms, which is yet another concern to add. There is an increasing incidence of patients reporting neurological symptoms, and this could be as much as a third of patients. Neurological symptoms are a big issue and increasingly makes the CCP virus look like a game of Plague Inc. The term neurological symptoms is a catch-all phrase, and to some extent not overly useful. Specific diagnoses have included things like Guillain-Barré syndrome, a situation in which the immune system mistakenly starts to attack nerve cells. This affects muscles and can eventually cause paralyses. Then there are incidences of encephalitis, which is inflammation and swelling of the brain. As with the heart-related issues, this is occurring in otherwise healthy young people. French studies show that up to 36% of patients may have been or were exhibiting neurological symptoms, although for the larger part these were at the mild end of symptoms. There were cases where there were more substantive neurological symptoms. It's thought that up to 84% of severe patients could be demonstrating these. The problem is not necessarily in the neurological symptoms, but for the fact they persist after recovery. What we are particularly worried about is that the CCP virus could be crossing over the blood-brain barrier and directly infecting the brain. If this is the case, it could be a massive problem, not necessarily one that is unique to the CCP virus, as influenza can infect the brain, but rather the breadth and severity of it and the long-term complications that we might see. These past two news items are worth bearing in mind when we talk about the next one. Many states and national governments are looking at lifting the lockdowns that are in effect. This has had a significant effect on parents of children. These are generally people in their 30s and 40s who have had to give up employment to some extent due to the lockdown. They are the group that would be most affected by the last two news items. The problem is, there is strong evidence that even if children are not affected to the same extent that an adult would be, or for that matter, the much younger and extremely elderly, they are still capable of acting as plague carriers. A review of 78 studies conducted by the UK Royal College of Paediatrics has said the role of children in transmission is unclear, but it seems likely they do not play a significant role. That would seem cut and dry, except for one thing. One of the researchers that authored the review has said that their findings were misunderstood and that children can pass the virus to adults. To quote that particular researcher, children almost certainly do transmit COVID-19. That's an important thing to keep in mind when you are about to do two things. One, put adults all together in places where they work. Two, put children into places where they are together and exposed to each other. This will effectively link households, either via the workplace or education settings. We can look at what happened with the 2002-2003 SARS outbreak to try and understand why this study has been misunderstood. It was well known at the time that children could be infected with SARS. If not to the same extent, still they were infected. This meant that although they would recover quicker and better, they were still able to infect others. We can extrapolate the results from that outbreak of a similar virus to the newer CCP virus and find that children do pose a viable vector for infection. As with any and all diseases, it's not just a simple matter of how is the disease transmitted, as has been shown by yet another study that has been able to link vitamin D deficiency with the CCP virus. Although it has yet to be peer-reviewed, the initial study fits into what we know and understand of the larger picture of health and disease. The collaborative research project from staff at the Queen Elizabeth Hospital Foundation Trust and the University of East Anglia believe that low levels of the hormone vitamin D could have an implication for mortality in Europe in particular. They were able to come to this conclusion by looking at the average levels of vitamin D in 20 European countries and then looking at mortality rates in each country. It's a simple statistical test, but there was a very convincing correlation. Now, as we've said, there is a complex picture at play, and this could be but one little block in the much larger structure that is the relationship of CCP virus, mortality, and simple quality of life. That study adds to the body of evidence around the CCP virus that is already confusing enough. A perfect example of this is that the World Health Organization, the CDC, and others still aren't sure that if you have had the CCP virus infection, that you are immune to getting it again. There are a variety of reasons why being infected once may not provide immunity. For example, being immunized for the annual flu does not necessarily protect you from the next year's strain. It may help to provide you with some protection or none at all. Second to that, we do have instances of vaccines that require multiple boosters before they take effect. This would mean that just one infection in one short period of time may not be enough to justify returning people to their places of work and education. For example, an adult who has been sick with it and recovered may catch it again, and under the misguided assurances that they are immune, pass it on to others, and then have to be tested again and go through the process of isolation, if not outright quarantine, for a period of weeks. The idea of creating a vaccine is laudable, but it's also a long way off. We are looking for alternatives. One of these is Remdesivir. Remdesivir is the drug that we spoke of last week, where the preliminary results were leaked, but they seem to be less than favorable. The company behind it disagreed and thought that the results weren't statistically supported. Remdesivir is an antiviral, and in theory, that should work in supporting patients with the CCP virus. The current study that has come out with more promise than what was thought before shows a 30% faster recovery than those who received nothing. 31% isn't a perfect result, but what we need to take away is what Anthony Fauci said. Although a 31% improvement doesn't seem like a knockout 100%, it is very important proof of concept, because what it has proven is that a drug can block this virus. That's the takeaway with this. It does improve patient outcomes, but more importantly, we can develop an antiviral that will eventually be able to block the CCP virus. At least the viral version that's killing people. No, wait, they're both killing people. The viral version that's spread across the world. Unlike other studies, this one has got statistical power behind it. It began at the end of February, and it involved 1,063 people across the US, Europe, and Asia. Having both a control arm and experimental arm means that having at least 1,000 individuals involved gives it the backing and authority, as far as statistics are concerned, to make the claims it has. As a tangential piece of news to the CCP virus, NASA engineers have designed a ventilator that could be mass-produced under emergency approvals in lieu of a coming second wave of the CCP virus. The engineers at the Jet Propulsion Lab in Pasadena, California, have built this in 37 days. It's called VITAL, and it is an acronym for Ventilator Intervention Technology Accessible Locally. Importantly, compared to other ventilator designs, it is the smallest, easiest producible unit that has 1/7 the parts required for what is considered a conventional ventilator. As Ford once said, invention is not done once you have added everything you can, but once you take away everything that is not needed. Not only has it been created and able to be built quicker, easier, and cheaper, but NASA is offering a free license to get this into hospitals. That means they have created the cheapest, quickest, and most likely effective ventilator and are offering it for nothing. To give some context on what reducing the requisite parts means, their design is anticipated to cost between $2,000 and $3,000 US. The low-cost alternative from commercial manufacturers is priced somewhere around $16,000 US. This design is between 1/8 and less than 1/4 the price. It's also designed not to compete with the supply chain for the commercially made units. That means they can continue to be supplied, while this can be made via other industries. That would mean that you can continue to supply commercial units and supply this low-cost emergency replacement or substitute. In other but very different medical news, a study into syphilis has found that altering just one gene can allow it to stay in your body and then resurge at a much later date. Syphilis is one of the most common STDs, or STI if you prefer. Historically, it has been treatable with antibiotics. Unfortunately, antibiotics are losing their effectiveness with it. Admittedly, they still work for the most part and are a far-flung improvement over the prescription of mercury as we did centuries ago. But if they're not effective, we have a problem. It's thought that there are about 6 million new cases a year, and these produce over 100,000 deaths. Infection and reinfection with syphilis is associated with the way it's structured. Syphilis is almost like a corkscrew in its shape. It's called a spirochete for that reason. And it's thought that that shape, along with an unusual outer membrane, allows for it to avoid the immune system and stay in a patient for a long period of time. Looking at someone who was repeatedly infected over a period of 6 years, they found that there was one gene called the Treponema pallidum repeat gene K. This one gene could have hundreds of changes in it. The resulting mutations are what is likely behind the ability of syphilis to avoid detection, reinfect, or remain in the body for an extended period, and then resurge to reinfect. If you think STDs or STIs are a sign of Mother Nature being angry with you, be thankful you don't live in Argentina. 2 years ago, they experienced some of the heaviest falls of hail that could be imagined. The hailstones were recorded to be massive, some estimated to be up to nearly 24 centimeters, or between 9 and 10 inches in size. They are massive and, to be blunt, most people who have looked at them would either think they're fake, or if they're an expert in the field, believe that they are at the extreme end of what you could expect to see from a hailstorm. We're not sure what Argentina's done to piss off Mother Nature, but she's not happy. To be more blunt about it, there are very specific and very special circumstances required to generate extremely large hailstones. These include a massive storm to begin with, then a updraft that lasts and is strong enough to keep the hailstones up high enough that they grow to that size. Then they need to fall down in a way that they don't simply smash into each other or in general on the ground. It's possible that Mother Nature was so angry with Argentina due to the number of parents there, and apparently being a parent makes you considerably less environmentally friendly. In a Swedish study, the results were simple. If you really care about the environment, you tend to not care so much once you become a parent. They believe this owes to the prioritizing of what you need to do with what, and whether or not you even have time to do certain things. And, as most people can appreciate, children are labor and time intensive. Finally, we have a study into the origins of human language. Communication is key to being human and being able to get along in the world. There's a diverse range of languages across the globe, and as a result, we have some difficulty in figuring out where they all came from. Things like European languages can be traced to an Indo-European root. North American languages are similar, and they have their own root. To a certain extent, even the Oceanian languages can be traced to some degree of common root. Past experiments with apes have taught them how to speak, and so, naturally, researchers have been looking at whether or not apes who are slightly less evolved than humans would have similar structures in their brain. For the most part, this search has been unfruitful. This study that we're talking about today has found at least an auditory system in rhesus macaques that is similar to what you would find in a human. The thought here is that if there is an auditory system in an ape that is, say, 1 million years younger in evolutionary terms than a human, it might be reasonable to say that humans also had a similar auditory system that allowed for communication. What we know of the fossil record would show that there is a 25 to 30 million year gap between humans and macaques to have a common ancestor. There's only about a 5 million year gap between humans and chimps. That's all we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you might have below.